diversity and inclusion this semester, we focused on the link between economic disparity and obesity. Our topic was the role of leisure service providers in reducing economic disparity and obesity incidences in the United States.
Background and historical presence of nonprofit organizations and services to low-income families. Obesity has been defined by the National Institutes of Health as a BMI, body mass index, of 30 and above. A body mass index of 30 is about 30 pounds overweight. The BMI, a key index for relating body weight to height, is a person's weight in kilograms divided by their height in meters squared. Economic inequality is the difference found in various measures of economic well-being among individuals in a group, among groups in a population, or among countries. Disparity is the condition of being unequal, and the disparity is a noticeable difference. Economic disparities exist among various demographics in the United States. These early non-profit organizations were usually founded by churches, religious organizations, and for the establishment of educational institutions.
According to research, obesity and economic disparity are proven to have a positive correlation, as counties with poverty rates of over 35% have obesity rates 145% greater than wealthy counties. People living in low-income areas have less access to fresh food and are more likely only to have access to unhealthy food if they have the money to afford a sufficient amount. People in low-income areas are also more likely to be sedentary due to a lack of outdoor facilities and inability to afford the necessary equipment to exercise. If obesity isn't prevented, people are more likely to get diagnosed with asthma, heart failure, or type 2 diabetes.
If obesity isn't prevented, people are more likely to get diagnosed with asthma, heart failure, or type 2 diabetes. There are several organizations that help with low-income families in order to prevent obesity. Organizations such as Alliance for a Healthier Generation, which works to provide students with healthier nutritional foods and physical activity. This organization also provides after-school programming to encourage physical activity and works to prevent obesity for low-income children specifically. Additionally, an organization called Family Promise helps low-income families coordinate local efforts in order to achieve sustainable independence physically, mentally, and emotionally. Last but not least, Stop Obesity Alliance is an organization that helps educate patients on ways in which they can change their diet in order to live a healthier, longer, and more active life.
There are many factors that contribute to obesity, as well as being linked to diabetes, heart disease, strokes, certain cancers, and liver disease. Some of these factors include biological factors, environmental factors, socioeconomic and cultural factors, and lifestyle and behavioral factors.
Some recommendations that we have are to encourage students to participate in breakfast, lunch, and after-school snack programs. Offer meals that meet national nutritional standards such as the U.S. Dietary Guidelines, and set minimum and maximum calorie levels to start breakfast and lunch for each age group. Some other recommendations are invest in cafeteria facilities to store, prepare, and display healthy foods such as salad bars. Avoid stigmatizing children who participate in free reduced price school meal programs. Also give students adequate time to eat and train food service staff in healthy food preparation techniques and food safety. Also incorporate nutrition education into school meal programs and increase financial support for school meal programs for federal, state, and local governments.
With a higher rate of obesity and a higher rate of poverty, the link is becoming apparent in what is happening within low-income families. Only 1 in 5 youth are meeting the physical activity guidelines. 10% of parents of young children don't have access to a local grocery store. Less than 20% of children are walking to and from school. And 50% of women of childbearing age are overweight. Children with parents that are obese are most likely to become obese as well. It's important that we exercise some of our recommendations that we've given in order to help those that are around us. If anything, we can also partner with organizations that are working to stop obesity within low-income families.